But PRP is something that I've done 3 times on my elbow. I've had incredible results. I know a lot of friends and family that have also used it. But I still get the question almost weekly, my man. Like, what is PRP? How do we create a better understanding for people so they can use that as a tool that's affordable, help tissue regeneration, and not necessarily get them cut on?
So PRP is platelet-rich plasma. And so we're taking your body's platelets, which if you have a cut on your skin, right, if you ever get a cut in your arm, what rushes to the area to cause healing to happen? It's the platelets. They cause that little clot to form. There's some inflammation. There's some swelling. And that's what we're trying to do. We're trying to concentrate these little healing cells and put them in the right place. So there's a couple nuances there. Platelet-rich plasma, got it? Coming from the blood. The big nuances here that I want anybody who's going to seek out platelet-rich plasma from a clinician is if somebody isn't pulling 20 tubes of blood, 20, they are not going to get enough platelets to make it platelet-rich plasma. Rich is the key word here, right? So if somebody's pulling about 2 to 4 tubes of blood and you get a good result, great. That's not necessarily the best quality platelet-rich plasma that you can get. It is platelet plasma, not necessarily platelet-rich. And to have a better result, you get higher concentrations, and the higher concentrations yield a better result. Now, not only platelet-rich plasma, putting it in the right place, how do you put it in the right place? So if somebody's not using an ultrasound or fluoroscopic guidance or both, they're probably not, they might get lucky. An elbow, a lot of people can inject an elbow and, and palpate and put it in the right place. But if you're going to inject a shoulder tendon, you're going to inject the spine, definitely don't let anybody inject your spine without using fluoro or ultrasound or both again. But platelet-rich plasma is the key here, and having the right concentration. The platelets are the healing cells that really recruit your body's natural stem cells to come to the area to hopefully help heal the tissue and resolve inflammation and help neogenesis and help tissue inflammation resolution. Those are the cellular processes that happen. So that's PRP, and those are some of the 2 nuances that I like to make sure that a patient sees or asks if they go see somebody. How many tubes of blood are you going to draw, doc, or whoever you're working with? And then are you going to use guidance, right? Those are the 2 things that I think would be the best yield for people with platelet-rich plasma.
Yeah, I like that. So what I'm hearing, just to kind of create a summary for people, they're going to pull that blood. 20 tubes or more should be drawn in order to get the true richness of the plasma. And what I'm hearing also is the analogy is almost like oil at the top of water. The plasma kind of floats to the top, and that's what you guys are pulling. Is that correct?
Yep.
And then based on that, you're re-injecting into the injured site to create an inflammatory response originally that then long-term will promote healing. And that's non-surgical. And that way you're not having to get cut on and go through a whole rehab process. You'll probably have relative inactivity for a short amount of time to let the chemicals do what they do. And then you can slowly but surely reintroduce patterns and movements that don't cause pain. You may introduce physical therapy or different physio approaches that help if there's any sort of like biomechanical issues that are leading to the pain of the specific tissue.
Bingo, yes. So you're taking the platelets. It's not a chemical; it's the cells from your body.
Sure.
But that's those cells are causing chemotaxis. They're causing all the cellular processes to be beefed up because you're concentrating them and then amplifying that response that would normally happen by putting it and making it 10 times fold, right? And the biggest thing that is in the literature right now that people are talking about is what is the number of platelets you're delivering to something. So for knee arthritis, you want to get about 10 billion platelets to get a mean clinical difference in outcome. Okay. Tissues, I think the content of the platelets you want is between 1 billion to 2 billion. Again, these are like nuances that you see. And, so platelet-rich plasma, I can just kind of give you, hold on, let me just show you this slide because it's just easy to show. And sorry, I do this all the time. So I like to,
I think the visuals are great for people, especially those that choose to watch on YouTube.
Yeah. So if you're going to watch on YouTube, this is where the PRP lives. Okay. These are the blood components, the platelets. Okay. And these are all the processes that are going to happen. So numerous growth factors, angiogenesis, inflammation resolution, cell migration, cell proliferation. So the red blood cells, we get rid of those. The white blood cells, we sometimes will use those in tissues because tissues seem to do better with leukocyte-rich PRP. And then the PRP lives in this level here. Okay. So hope that's a good visual for anybody who's watching. And if you aren't watching, jump on there and watch.